Hi, good afternoon. I'm Dr. Luther Mangoba, and I practice here in Riverside. I am a family medicine doctor, and I wanted to share with you some information about COVID-19 that I hope will help alleviate some of our concerns and our fears that's running around in our community. So I'm doing this as a community service, and hopefully at the end of the presentation, you'll feel a little bit more relieved and at least empowered to deal with the changes that we're all facing. And so let's begin. So if you haven't heard, COVID-19 stands for Coronavirus Disease 2019 because it was first diagnosed in December of 2019. And it is caused by a quote-unquote new coronavirus. So coronaviruses are a group of viruses that regularly infect humans, and they will, for the most part, cause the common colds. And so the virus that causes COVID-19 is related to the viruses that cause common colds in humans. For this particular viral strain, it is new because it originated from viruses that will typically infect bats. And through mutation, this novel coronavirus attained the ability to infect human hosts. And because it is new, no one in the world has any immunity against it. And that's what makes it a significant threat for our healthcare system and for our populations in general, because there is no innate immunity that is available to, number one, reduce the number of possible hosts. So everyone in the world is a potential host for this new virus. And because there's no immunity, the severity of the illness when it infects certain individuals can be very severe, that it, in certain cases, may cause death. So I just wanted to show you a picture of a common coronavirus. This is a what we call a scanning electron microscope that actually shows a somewhat 3D rendering of the common coronavirus. So the most important thing, how does this coronavirus spread? Well, it's actually spread through what we call respiratory droplets. And so when an infected person has the virus and has the symptoms, the virus actually enters our mouth, our nose, or our eyes and down our tear duct, and we actually have the infection start in the lungs, and specifically the lining of the lungs, the cells that line the surface of the lungs. And when the droplets enter the lungs, the virus replicate, and they cause a variety of symptoms. And in most people that are infected, the symptoms are actually very mild, but the common symptoms I'll mention earlier or later. The droplets are something that is generated when we all breathe, when we all cough, and when we all sneeze. And because of that mode of transmission, anytime you're in very close proximity to another person who is infected but may not be symptomatic, you have the potential for introducing those infected droplets from one person to another person. There are some thoughts that freshly contaminated surfaces may also harbor the coronavirus. Based on what we know of the coronaviruses that cause the common colds, some of these surfaces, specifically plastics, glass, or hard non-porous surfaces, the droplets which contain the virus may allow the virus to remain viable for a couple of hours. In some cases, they have done some testing, and some of the viruses have remained viable for up to 24 hours. So, knowing these modes of transmission or spread, there are some very common sense interventions that we can actually do to prevent it. And we'll talk about that shortly. So, as I mentioned, the symptoms that an infected person may develop, most common is actually fever, cough, and shortness of breath. Those three are very common in common colds, the common flu, even bacterial pneumonia infections. So it's very general in terms of the symptoms. Less common include runny nose, sneezing, sore throat, and diarrhea. So if you have a combination of all of those, what we are looking for as healthcare providers to determine if you have high risk, we're actually really looking for the first three that I mentioned, the most common symptoms. And if you have three of those, or even a couple of those, plus an exposure to somebody that may have had COVID or has been in an area where COVID has already been noted to be in community spread, you are someone who we may want to consider testing if it's something that's available for you and can be done safely. Symptoms after you have been exposed to the coronavirus may not occur immediately. In most cases, it may occur as early as 2 days. Most of the studies show it can last up to 14 days, but I think there have been cases where the incubation period was as long as 3 weeks. So that's very important in terms of what we do to determine how we best minimize exposure to individuals who may or may not truly have COVID-19. The symptoms of severe COVID-19 does include pneumonia-type symptoms, so high fevers, severe shortness of breath, and in a very small subset of cases, you may have something called multi-organ failure, which means not only are the lungs involved and are not working properly, but other organs may be affected as well, including the kidneys, the liver, and pretty much all of our internal organs, when they are stressed beyond a certain point, are subject to some injury, but not directly by the virus, but more likely due to an overreaction of our own immune system in terms of trying to fight the infection. And a lot more detail to talk about that. I'm not going to have time in this presentation. So, testing. Testing until recently was really only available at FDA-approved laboratories. But as early as last week, the FDA did approve additional labs to perform the testing. And so, for the most part, all the patients who are being treated at the hospitals with suspected COVID-19 are going to be tested. And additionally, here in Riverside County, because of our outbreak in the Coachella Valley, Indio area, the Riverside County Public Health Department has actually set up drive-through testing in Coachella and in Lake Elsinore. And I'll give a little bit more information on that outside of the talk, but if you just Google Riverside County Public Health Department and COVID-19 testing, they will have information on their website regarding how to actually get an appointment for the drive-through testing. So you need to have an appointment, and you have to meet the screening criteria for COVID-19 in order for you to be given the appointment to get tested. And as I mentioned, all hospitalized patients with COVID-19 type symptoms are being tested. So not everybody who will get exposed will get sick, and 80% of those who do get the infection will have what we call mild illness. So that's pretty much what we just mentioned earlier, the most common symptoms, cough, shortness of breath, and fever, but these are low-grade fever. Shortness of breath is very minimal, and the coughing may or may not be with phlegm. So it can be a dry cough, or it can be coughing with phlegm. About 15% of our patients will get what we call severe illness, and that's illness that is significant enough that you'll want to seek medical care and will most likely need to be hospitalized in order to receive supportive measures, which includes oxygen, IV fluids, and other IV antibiotics to potentially minimize the risk of getting what we call a co-infection, so another infection with another agent, whether it's another viral organism or another bacteria. 5% of those that are infected are likely to get what we call critically ill or critical illness. These individuals will most likely be the ones that have respiratory failure, so the lungs have failed. They may likely or most likely will need some type of ventilator support and will definitely need medications to help support their blood pressures, possibly continue to keep their heart beating. So these are the ones which would typically be severe enough to be in the ICU. So 80% of us not likely to need anything. We will be healthy enough to just let the illness take its course within the comfort of our own home. But the other 20% will require hospitalization. So who are those individuals who will most likely need to be hospitalized? A very select group of individuals. Number one, age. If you're actually 65 years or older, it's been shown that you are most likely, if you have COVID-19, are going to have a higher probability of having a severe illness. Individuals with chronic health conditions, most common ones are lung disease and heart disease, so COPD, emphysema, asthma, heart failure. If you have a weak heart, those are all potentially high-risk conditions that will make you have a higher probability of having a severe or critical illness. And then the third group is just lumped into what we call an immunocompromised person. So if you're taking chemotherapy for some type of cancer, if you're on steroids for some other autoimmune conditions, like asthma, plenty of patients taking steroids for asthma, you're potentially immunocompromised because of the medications that you're receiving. Okay, so an ounce of prevention is worth a pound of cure. I'm just going to finish it. So, what can we do as a community and as individuals who are concerned about our health and the health of our family members, our loved ones, our neighbors, our friends? First thing we can do, and this applies not just to COVID-19, but pretty much just in general, gotta wash your hands. I see plenty of people who disregard that very common recommendation, and it's so simple that you can save a life, maybe even your own, just by washing your hands. We do recommend soap and water, washing for at least 20 seconds, and the soap not likely to get rid of the virus or kill it, but I think it will help get rid of other debris, the droplets that may contain the virus will get washed away with really running water, 20 seconds, and vigorous scrubbing. Okay? Now, if washing your hands is not an option because you don't have running water nearby, it's actually been shown that a hand sanitizer containing at least 60 to 95% alcohol is actually effective in disabling, or in this case, deactivating the coronavirus. Okay? Additionally, not only do we want to minimize the amount of virus that's in our hands, we definitely don't want it touching our face, because once a droplet lands on your mucosal skin, so skin on your eyes, your nose, your mouth, it has potential to get into your airways and therefore into your lungs. So you don't want to touch your face, especially if you haven't washed your hands. And if you do touch your face, it's a good enough excuse to wash your hands again or use a sanitizer before you go about doing other activities, so you don't contaminate other surfaces, or at least pass on what's on your hands to somebody else. Okay. Obviously, reduce exposures to sick persons. Not only are sick persons infective or contagious, there's been reported cases where contacts of positive COVID-19 infected individuals subsequently developed the disease, and they were exposed to the other person before the person exhibited any symptoms of illness. So not very common, but for sure if the person is ill, they're more likely to be harboring the virus, and they're more likely to pass it on to somebody else. Got to reduce the exposures. Okay. Flu vaccine. Now, why is this going to help with COVID-19? Indirectly, it will help because the flu did not get replaced by COVID-19. Okay, we have to deal with the flu. Now we have to deal with COVID-19. If your immune system has not been prepared or strengthened with the flu vaccine, and you potentially get infected with either one, your immune system is now less able to fight off or prevent the infection from the other organism. And so getting the flu vaccine, it's not too late, will actually help improve your immune system, so that should you get infected or exposed to COVID-19, you don't have to worry about potentially getting a co-infection with the flu. Okay, another ounce of prevention. So social distancing, one of the buzzwords in the media. So what does that really mean? Well, essentially we want to reduce the amount of exposure we have to other individuals. And so human nature being human nature, if we made it something that is not mandatory but elective, we're going to have more people that will choose to risk maybe getting the infection or potentially being contagious to others and still go out in public. And so what the state government and federal government and other national governments worldwide have essentially instructed is they've reduced or stopped all events, all venues, pretty much any reason where large gatherings of people will congregate and potentially get infected without knowing it. And so large crowds, close proximity, perhaps eating at a restaurant, attending church services, going to school, going to your doctor's office. So all of those contacts have also been required to be minimized in order to reduce the number of infections that will occur as this pandemic runs its course. Okay. The other thing is minimizing physical contact. Okay, so handshake, hugging, even fist bumping, probably not something that we'll recommend at the meantime, mainly because we definitely want to ensure that we have the best effort we can put forward to minimize the further spread of the coronavirus causing COVID-19. Face masks. If you have some and you were fortunate enough to have some before the shelves ran empty, the CDC actually does not recommend that you use it as a general safety precaution. So all of the safety measures mentioned beforehand are probably more effective. There are obviously some instances where face masks are required and mandatory. So if you're a healthcare worker, an N95 respirator, when you are going to have contact with ill patients, definitely a requirement at this point in time. If you're an ill person and you do have to leave the house, so for example, going to the hospital because your symptoms haven't improved, potentially going to one of the drive-through testing sites, wear a mask, mainly because that additional barrier should help reduce the amount of droplets that you're releasing as you go out in the community. Okay? Decontaminate surfaces. The CDC actually has a recipe on their website for how to use household bleach and the ratio with water in order to create an effective solution that you can use to spray or wipe down surfaces. So in this case, they're recommending 5 teaspoons of bleach, chlorine bleach, in 1 quart of water. Now that solution is not going to be effective indefinitely. Chlorine will become a gas, and so if you leave that bottle with the solution open, the chlorine will evaporate. If you expose it to sun, that will also be deactivated because of the UV. So if you're going to make this solution, pretty much keep it covered, sealed bottle, and definitely out of sunlight, preferably in a cool environment. That will help prolong the effectiveness of it. Probably every couple of days you might want to just create a new batch, just because you don't want to risk the effectiveness of that solution in using it and not knowing it's not protecting you. Okay, flatten the curve. What does this mean? Okay, well, very simple. The curve that they're referring to, I'm just going to show you right here, is if we did not do any controls, if we didn't do any interventions to reduce the number of infections or the rate of infectivity, we can see a huge steep surge in the number of infected individuals. Okay? And the problem with this curve is if we can only provide care for, say, this many number of people, represented by this horizontal line, if we exceed the capacity of our healthcare system to care for the critically ill or severely ill individuals, not only will we endanger all the other patients that are currently in the hospitals that are being treated for something else totally unrelated, we can actually endanger the physical number of healthcare workers that we have who are safe enough to actually go out and care for patients that need them. Okay, so the purpose of flattening the curve really is to make sure that we do not exceed the capacity for our healthcare system to care for the persons and the population that is ill. So a big example, in South Korea and even in China, after probably the first couple of weeks that the epidemic started, they were able to flatten the curve, and they were able to restore, at least in China, the supply of healthcare workers to provide the needs of those that were ill. In South Korea, where they were actually prepared and they took the steps before their community spread, you'll actually see, I'll show you some numbers, they actually have less than, I want to say 200 or 300 deaths so far, okay? And so that's a testament to the effectiveness of social distancing and the proper precautions that have been recommended in terms of hygiene, hand washing, and reducing physical contact and proximity. So one of the things that hasn't been mentioned with flatten the curve, in which I'd like to point out, is the curve represents the number of total people that are infected. And I believe, and it's not really mentioned in any of the drawings or diagrams I've seen, the whole purpose of what we're doing, and it's going to cost a lot economically, is not just to slow down how fast the people get infected in our country, but we actually want to slow down the number of people that do get infected. Okay, and it's not mentioned anywhere that I've seen, but I think if we flatten the curve by doing our social distancing, not only will we see a less steep increase in the number of infected, we'll actually see a overall reduction in what we could expect to see if we didn't do any of the interventions that we're doing. And so we're going to see the fruits of all of these, not immediately, but maybe in 2 to 3 months we can all look back and say, hey, you know what? The number of infected in the U.S. was less than expected, and some of the experts were saying up to 60% of our population can get infected, but that was on the premise that we didn't do anything. And we're obviously doing something, and nothing is in a vacuum. And so I am very hopeful that at the end of the day, the predictions are going to be wrong, mainly because the predictions didn't take into account the resourcefulness, the willingness to change on behalf of our communities in order to reduce the impact of COVID-19. But this is what that flatten the curve really means, is we want to slow down the rate of infections. In my case, I want to reduce the overall infections as well, which I think we will get. Okay, so at this point, I actually wanted to show you an infection simulation in terms of what happens if we allow everyone free movement, or if we quarantine, and if we do social distancing, which is what we're doing now, and reduce the number of mobile individuals within our community. So let me step out of this, go into the website. This is actually taken from the Washington Post, and I'm going to have to give them credit. And the website is right here on my screen. You can see it. You can run this simulation on your own, and it's not going to be the same every time you run it. I've tried it, and it's different every time. But what I want you to notice is the recovered, the healthy, and the sick. So this is the result of one of the simulations I just ran. So I'm going to run it again. So 200 people, so represented by 200 dots. These light blue, I'm colorblind, but these light blue, to me, dots are healthy individuals. The sick are the ones that are red, and then I believe I'm going to call this purple. Betty, is it purple?
Purple.
Okay, purple is going to be the people that recovered from the infection. So this is a simulation of no restrictions on mobility, no social distancing. Okay, so in this example, everybody is moving willy-nilly, infecting anybody that they come into contact with, and over a period of time, everybody in the population got infected, and in this case, they didn't mention any fatalities, and so everybody recovered. Okay, now if that were the case, we wouldn't be doing anything that we're doing, which actually, we kind of are already doing this. Common colds. Okay, so prior to COVID, people were still going to work when they were ill, runny nose, sniffly, somewhat achy. They still went, and guess what? They were probably infecting other people. Same thing with the flu. People were doing this before COVID-19. Okay, so let's see what happens when we set up a quarantine. So this is what the Chinese government did in Wuhan, China, and so as long as the quarantine is held, the infection is kept away from the rest of the population. But once the quarantine, either one person from the quarantined area leaves, or for whatever reason, the virus escapes the quarantine area, and now the rest of the population is again infected. But in this case, if you look at the curve is actually a little bit flatter. It's not as sharp, and it didn't peak as high as the unrestricted movement. So now, if we restrict in this next slide, I believe it's going to be 1/4 of the people will be permitted to move. Okay, so 75% of us are still, and 1/4 are allowed to move. So with social distancing, as you can tell, there's actually 70 in this simulation. Out of the 200 people in the fictional town, 73 people actually remained healthy over this period of time. 85% recovered and 42 still remain sick. And so, again, the curve is a lot flatter on that simulation. And now if you kind of go back down, this is the last simulation. This is 1/8 of the people are allowed to move. So think of it as maybe California now. All the restaurants are closed to dine in. Pretty much all businesses are closed with the exception of what we call the critical infrastructure workers or industry. And so let's see how many more people here remain healthy, meaning they don't get sick. There we go. So as you can see, the area covered by the red is even flatter than the previous example, and this swath of light blue is even larger and broader, meaning that there was even less people infected. So here there was 106 healthy as opposed to the previous one, which I think we got at 73. Okay, all right. So that kind of explains what we're trying to get, or the results we're wanting to achieve with the social distancing that we're doing. And I think we're seeing it actually because the experts, when they run the math and do the scenarios, as I had mentioned earlier, they're thinking 60% of the population would get infected. And if we didn't do anything, we would actually see a larger peak in the number of cases that we're actually seeing in the country and worldwide. But we're not seeing that. And in fact, in China and in South Korea, the number of new cases is actually starting to slow down. There's actually more people recovering than there are getting new infections. So that's always a good news. When there's more people recovering compared to the number of new infections, that means that we've already hit our peak. We're now starting to go on the downward slope, which means it's a little bit easier in terms of the demand on our healthcare system, and we should start to be able to ease off on some of the social distancing that we're doing and somewhat return to a new normal. Okay, I want to say new normal, not normal, because it'll never be the same as it was before this. Plenty of people will probably change, and I'm hoping everyone will change how they behave with regards to hygiene and hand washing. So if you are sick, what do we want you to do? Well, if your symptoms are mild, stay at home, okay? You definitely don't want to go out in the public, and if you perhaps don't have the COVID-19 and you go out in public, there's a possibility you might get it. So if your symptoms are mild, stay at home. Probably the best thing for you to do for yourself as well as our community. Now, when should you seek medical care? Well, most doctors I know, including my office, that have a clinic, you should call your provider. So they will offer telephone or telemedicine visits So that way you can get further guidance, and they will be able to send prescriptions in on your behalf if they feel that you need it after you talk with them. Now, if you are not able to reach your physician or your provider, or your symptoms are severe, so for us, severe, if you have severe shortness of breath, I would gauge shortness of breath by your ability to talk. So if you can talk, and you don't have to stop to catch your breath, your shortness of breath is probably not severe enough. If you can barely finish a sentence, probably severe enough, time to consider going, okay? High fever, so our fever cutoff, I saw some numbers, they're saying 100.9 was what we would consider a high fever that would be most likely consistent with COVID-19. So if you have a low-grade temperature, we say that's 99, 100.1, 100.2, but it goes away after taking Tylenol, probably something you can manage at home with Tylenol. Difficulty keeping fluids down. We don't want anybody being dehydrated. If you drink and doesn't come back out, you're probably okay maintaining your hydration. Again, you can stay at home, okay? If you can't keep anything down, good time to call your doctor. They may prescribe you something for the nausea and the vomiting or diarrhea. But if that doesn't work, definitely go to the emergency room. If you're going to go out and you're sick, wear a face mask. Protect others mainly. Okay. If you're coughing, sneezing, elbow, if you happen to have tissue, that would also be good. And after using the tissue, even if it was your tissue that contacted your face, hand sanitizer. All right, decontaminate exposed surfaces. Laptops, for most people, phones, or other high-touch objects, so doorknobs, cupboard handles, kitchen counters, stuff like that. Decontaminate. Use the bleach solution that we mentioned earlier. The World Health Organization recommends Tylenol first for fevers. There was some talk about ibuprofen causing the symptoms to be worse, and this was based on some what we call anecdotal data from some doctors in France. The World Health Organization reviewed some of the data. They're actually recommending you can use either one. There's no recommendation to actually avoid ibuprofen. But my recommendation, and I think the middle ground, use ibuprofen only if the acetaminophen doesn't work. Okay, so acetaminophen first. If that's ineffective for your fevers, then you can try ibuprofen or other related medications. So aspirin can help reduce fevers as well, and so can Aleve or naproxen, some other name brands. Okay, all right. Immune boosters. This is my favorite because this is all part of prevention. Okay, you need adequate rest and sleep for your body to regenerate and to have a healthy immune system. If you're not getting enough sleep, definitely. Balanced diet. Okay, what does a balanced diet mean? Fruits and vegetables along with all the other stuff that we would consider on our food pyramid. Okay, in moderation and in the right proportions. Stay physically fit with regular exercise. This is one of my favorite. It's free. You don't need a gym membership. And it has been shown that regular exercise will improve your immune system. We actually, there's enough medical research out there that I have reviewed and I trust that the results are reproducible. So a healthy dose of regular exercise is beneficial for the immune system, but for a whole host of other health and organ systems in our body. Smoking, bad for your health, bad for the wallet. Okay, I think it's like $10 a pack now. Definitely something that you should avoid. Even secondhand smoke can actually cause problems for the lungs. For those that smoke actually inhibits your immune system on the surface of your lungs. So you could be considered a high risk or immunocompromised individual if you smoke regularly because of the effects of the tobacco on your lungs. Okay. Laughter is the best medicine. It's also very cheap. Plenty of reasons to laugh at appropriate times. But even just laughing, just belting one out, even without having something to laugh at. All right. So just laugh. If you just have to laugh just to make the sound. It's been shown that just laughter releases stress and tension in the body, and it is actually helpful for the immune system. Reduce stress, whatever means. For me, reducing stress, a lot of these will help me reduce stress. So laughing, exercising, sleeping, all of those will help reduce the stress. Okay. The reason we say reduce stress is this. Stress causes your body to release endogenous steroids. As you know, steroids can potentially impact the immune system. So if you're chronically stressed, you're chronically secreting higher levels of steroids than would normally be in your body. Excuse me. If you reduce the stress, the normal or endogenous secretions of steroids will go down, and that should help kind of allow your immune system to function more properly and normally. Okay. Vitamin C, we know, is a time-tested vitamin that has helped with the immune system. There's some newer studies that actually vitamin D may also help. Okay. So if you are not taking a multivitamin, you might want to consider taking one. And most of the multivitamins tablets will actually have vitamin C and vitamin D inside the pill or the tablet. So, not everything is actually bad news. There's actually plenty of good news for us to share. As I mentioned earlier, the infection rates in China and South Korea has started to decline. Recovery rates are starting to be more than new infections. It's always a good thing. Social distancing, as can be proven by what we're seeing in China and South Korea, is actually very effective. And we're also seeing it here in the States. The expected curve in terms of that curve that we mentioned earlier is actually not as steep as what was predicted had we not done anything. So the infection curve is actually more shallow. So we know that it's actually helping. Okay. As more and more people recover from COVID-19, we'll have something called herd immunity. Okay. What that really means is this. If you remember our slide with the simulation, the dots, the people who are recovered in that simulation can no longer get the infection. So moving forward, even if COVID-19 and SARS-CoV-2, which is the virus that causes it, remains in our community as a ongoing infection, just like the common colds and the flu, the impact it will have next year and in subsequent years will be far less because there will be less susceptible hosts. Okay, and not only will we have herd immunity, I suspect that within at least a couple of years, more realistically a couple of years, there's some maybe saying a year we'll have a vaccine. We should have some potential vaccine available that will help immunize healthy individuals and therefore reduce even further the number of susceptible hosts in our communities. Now, for those that have COVID-19 that was severe and required hospitalization, there are several agents that has been shown to be effective in reducing the severity. I'm only going to mention one, mainly because it's an agent that has been around for many years. It was actually used for malaria before anything else, and currently is still being used for malaria, but also is being used for people that have autoimmune conditions like lupus, rheumatoid arthritis possibly, Crohn's disease. So several other immune-related chronic diseases are being treated by this. So the agent is readily available, and the companies that manufacture it actually release their stockpiles to the hospitals here in our country, and I think worldwide. And so it's something that has been proven to be safe, and currently has been shown to help reduce the severity of the symptoms that people will have if they get the COVID-19. So that's a good sign. If we can reduce the severity, we'll actually reduce the number of people that will need ventilators. So main reason why we're mentioning that. There's several other antiviral agents. One or two are still experimental. They were using it initially, they were trying to develop it for Ebola and I believe SARS. So these were some agents that were already around but were used for other infections. They're just using them and trying to see if they're effective for this new mutated strain of coronavirus. I'm not mentioning those because it's not going to be readily available to the common public. Most of the people that will get that are probably the ones that are in hospitals critically ill, and it's going to be given to them as an experimental drug. So statistics, just to kind of help give some perspective to what we're seeing. And hopefully the numbers will help alleviate some of the concerns that we all have. Okay. Globally, the World Health Organization has indicated there's 372,757 confirmed cases of COVID-19 as of today. This is based on their website. Globally, 16,231 deaths as of today, 3/24. In the U.S., the total number of infections to date, 44,183. It's a significant number, but I'm going to show you some additional numbers and we can compare and should hopefully alleviate a lot of the concerns that we have. U.S. deaths, 544 Americans have died from COVID-19 since its outbreak. Okay, so in comparison, this is also from the CDC. In 2018, we had 37,991 fatalities related to motor vehicle accidents on public streets. 37,991 deaths. Guess what? Those are all preventable deaths. Okay? It's car accidents. In 2017, 38,659. Okay? In the U.S., HIV is still an epidemic. We have every year there's still more infections than we would like to have. In 2018, 37,000 new infections of HIV. In 2017, 16,350 deaths. Okay? Now, let's compare this to even some larger numbers. Influenza. This is, again, also from the CDC. 2019 to 2020 season, so the one that, the season that we're still in. Typically August of the one year till April the following year, or May. CDC estimates we've already had 30 million infections, 390,000 hospitalizations, 23,000 deaths. So I don't want to downplay the potential impact that COVID has, but I wanted to just share with you that we've actually done plenty, and with the social distancing and all the other changes that we've done, we've actually done a pretty good job of minimizing the actual number of infections. Okay, 38 million versus 44,000. 544 deaths from COVID versus 23,000 deaths from the flu. So what do I take from these numbers? Well, number one, the interventions that we're doing for COVID-19 is actually applicable not just for COVID, but for the flu. So we will reduce the number of potential flu deaths that we'll experience this year because of the social distancing. We are definitely going to reduce the number of COVID-19 infections. We're already seeing it because the curve is not where they had predicted it would be. And in the long run, I think the total numbers of COVID-19 fatalities is going to be far less than what we're seeing with the flu. Okay, And the reason I can say that confidently is as long as we maintain the behaviors that we're already doing, hand washing, covering our sneezing or our coughing, minimizing some of the contacts that we typically will do. All of those have been effective at reducing the infection rates of COVID-19. And so if we had 23,000 deaths from 38 million infections from the flu, I can only say that we will have far less infections with COVID-19. And the death rates, the estimates for the death rates are always going to be high initially. And the reason for that is we can't really determine how many people actually had COVID-19. There's some experts out there. The World Health Organization, I think, has some graph that I saw. The number of confirmed cases probably only represents, and the total number of people that were tested, okay, probably only represents like 30% of the actual number of cases out there. So if we did our math, if 44,000 only represents 33%, I would have to triple that number. That's probably the number of people that we probably currently have that has COVID-19. So if you divide 544 by 150,000, that number comes out to like I want to say 0.03 or 0.3%, which is far less than the 1 or 2% that you would calculate based on the actual confirmed cases that we have. So, closing, proper perspective, we just need to, the numbers that we see have to be taken into context. Be concerned, but do not panic, right? I like this one. We are desensitized to common dangers. So if you're presented with the same stimulus day in, day out, you kind of learn to tune it out. You ignore it. Well, I've shown you some numbers. The flu is a far larger infection than we give it credit for. HIV, car fatalities, those are all really large numbers, and we don't have as much awareness of them because I think we've just learned to ignore them. With every disaster comes the opportunity to, and I kind of just gave some examples there. Well, it's an opportunity for us to help others. So I've seen plenty of community members, businesses, individuals actually come together and help each other out. It's always good. We're learning something new with this COVID-19. The learning curve is actually faster than I've seen with many of the other type of infections that we've seen in the past. And it's an opportunity to change and grow. So I'm hoping that some of the behaviors that we learn to help minimize infections is something that we incorporate into our daily lives, so we change our behaviors permanently. And we should grow as a community, kind of learning how to really just be altruistic and help others as we encounter, hardship or challenges. I like to see the glass half full as opposed to glass half empty, which is why I presented with you some of the other information and ideas and wanted to present COVID-19 in a different light. Okay, so again, it's a reason for concern, and I think we have taken the right step to addressing it, and we just want to make sure that you do not panic. And I think that ends the talk. And
we have a couple questions.
Oh, we do have a couple of questions.
Yes.
Okay.
We have a couple questions. So one here says, can I catch COVID-19 from my pets?
Okay. Question is, can I catch COVID-19 from my pets? Okay. So, as we mentioned earlier, the novel coronavirus, SARS-CoV-2, actually is a mutated strain that originally only infects bats. So, it mutated and it somehow got the ability to infect the human lung. The COVID-19 virus, the causal virus, is not likely to infect animals, and this is what the experts are saying, and therefore the animals are not likely to serve as sources or hosts for the virus, which can ultimately infect humans. So, the short answer is experts say no, you cannot get COVID-19 from your mammalian pets. Okay, cats, dogs. I guess some people have pigs and goats as pets too, but so no.
Okay, and another question is, how long does a virus survive on surfaces?
So, how long does the virus survive on surfaces? It depends on the type of surface that the droplets will land on. If it's a non-porous surface, so glass, metals, plastic, even some types of synthetic materials or wood, as long as that surface does not allow for the fluid in the droplet to kind of get absorbed, the virus has an environment where it can kind of stay viable. So the experts say, for the most part, in droplets, if it lands on like inanimate objects, at the very minimum, it can last for a couple hours. And there have been some reports that the viruses have remained viable for even up to a day or a couple of days. Okay, which is why it's very important to decontaminate surfaces often and regularly, so that regardless of when the droplet lands on that surface, you deactivate the virus with the solution, either the alcohol solution 60 to 95%, or the bleach solution that we mentioned earlier.
Okay, and then last one is that, is the virus airborne? So
we gotta distinguish between airborne versus droplet. Okay, so the virus, the experts, based on what we know of coronavirus in general, the ones that cause the common colds, the coronavirus are transmitted through respiratory droplets, and they are not airborne. What that means is the virus cannot typically be transmitted if you were to take like a culture of the virus and then just blow it in dry air, which would be what I think some people are asking if I'm assuming that's what they mean by airborne. The experts say no. Okay, so the virus, in order to remain viable, has to have that fluid for it to kind of sit in and be transported in order to retain its viability once it reaches the proper host. And so it is not airborne, but it is droplets, respiratory droplets. And the droplets can be very small, okay? So droplets can be as small as 1 to 2 microns is what I heard, which means even an N95 respirator may be insufficient to block that particular droplet, because the opening within that filter is potentially too small. Now, the good news is the larger the droplet, the more likely it will contain a larger number of viruses. And so one virus alone is probably, one particle of that virus getting into your airways is probably not going to be sufficient to cause an infection, because your immune system is there and it will be on guard 24/7. So in order for the infection to actually get started, the initial assault, the number of viruses that assault your lungs at the get-go, has to overwhelm the immune system's immediate response. And so that's why a larger viral load is necessary to cause the infection to occur. So, theoretically, one virus can make it, but in practicality, we would need more viruses potentially to get into the lungs, overwhelm the initial defenses before an infection does occur.
So if you're walking down the street and you happen to pass someone who happens to have the virus, you're more likely.
Right. So if you're walking down the street and you just happen to be, walking in opposite directions, and they happen to sneeze right within that 3 feet distance, or let's say 6 feet, because we're saying 6 feet minimum. So closer you are, they sneeze. The amount of viruses that you are potentially going to inhale from the droplets that were generated potentially may not be enough. And so, because it's as soon as that person coughs or sneezes, now you have an entire area to fill, and so the amount of droplets that you will inhale with the 1 or 2 breaths that you potentially will take as you pass may not contain enough respiratory droplets to have enough viruses to actually cause an infection. Okay, but that's not to say again that even one virus will be potentially sufficient to cause an infection, assuming that it overcomes all of the defenses that your body will set up, and go from there, because it only takes one copy.
Thank you so much, Dr. Luther Mangoba, for your time today. We appreciate you. Any last comment?
That's it. Just be safe, practice good infection control practices, and I think do not panic, do not be alarmed, but take precautions. It's common sense thing to do, and I think we just need more common sense than anything in terms of maintaining proper hygiene and hand washing, and I think that would be the best approach for everybody, and the best that we can do as a community to help contribute to essentially stopping COVID-19 from spreading.
Thank you very much.
All right,
We
thank you.
appreciate it. Thank you.